Welcome, everybody, to the Long-Term Care Certification in Infection Prevention lecture series. This is a group of lectures put together collectively by a group of IPAC Hubs in the Greater Toronto Area with the intention of helping IPAC leads in long-term care obtain their certification. Let's jump right into it. So my name is James Callahan, and I'm here to introduce you to our LTC-CIP lecture series. So my intention today is to quickly explain to you how the following resources have been put together and how these resources will help prepare individuals for success in challenging their LTC-CIP exam. So I'd like to take 10 minutes of your time to quickly orient you to the content that's being provided. We'll quickly review the eligibility requirements for the LTC-CIP exam and who our target audience is for these lectures. What? We'll explain what these lectures are and how they're organized. When? We'll review why we think it's important that you as an IPAC lead in LTC challenge this exam prior to 2025. Where? This lecture series is being brought to you through these recordings, through some live presentations, through your local IPAC hubs. And why? We'll talk about the requirement for certification under the Fixing Long-Term Care Home Act. Finally, how we'll finish with some strategies to help you successfully challenge the exam. What is the LTC-CIP designation? It's a great place to start. So the Certification Board of Infection Control and Epidemiology holds multiple certifications. And how do you know that the LTC-CIP is the right one for you? Well, we've got three different designations up here on the board. We've got the Associate Infection Prevention and Control. That's AIPC. That's an entry-level certification. That's a measure of basic IPAC knowledge. So this is the right choice for you if you really want to spruce up your resume while you're applying to entry-level IPAC jobs. The CIC, the Certification in Infection Control, is typically written by those who work in acute care settings that have at least 2 years of working experience in infection control. And the newest designation, the LTC-CIP, is a certification that provides a standardized measure of basic knowledge, skills, and abilities that are expected of professionals responsible for IPAC programs in long-term care. All of these designations are internationally recognized. This lecture series is specific to the LTC-CIP. Who are we? So we are a group of infection prevention control specialists with a focus of attention on long-term care. We're colloquially known as the IPAC Hubs in Ontario. And so this lecture series is brought to you by Michael Garron Hospital, Scarborough Health Network, Lakeridge Health, the University Health Network, and Scarborough Hospital. And we all share a common interest. We want to deliver education and training to IPAC leads in long-term care. We want to host a community practice that supports information sharing and networking. And finally, we want to mentor those who are responsible for IPAC programs in congregate living settings. Who is this lecture series for? So it is directed specifically for IPAC leads who are working in long-term care homes in Ontario and are responsible for the IPAC programs in their home, and people who are looking to achieve their certification. This content lecture is guided by IPAC's Infection Prevention Guide to Long-Term Care. So you may be asking yourself, am I eligible to write this exam? So here are the eligibility requirements for this exam. First, you must have completed a post-secondary education in a health-related field, and this is not specific to Canada. You must also be responsible for the IPAC program in a long-term care home setting. So it's important to note people who are writing this exam are already working in this role, and the Certification Board of Infection Control recommends, but does not require at least 1 year of full-time experience prior to challenging the exam. Here is the IPAC competency model. So on the border, you're going to see 6 core competencies that are outlined as areas of expertise for IPAC leads. At the center of the competency model is patient safety, and that's our ultimate responsibility. From the middle, moving outwards, you'll see that it starts with being a novice IPAC lead, and then as time and experience and likely a few mistakes, as was the reality in my case, IPAC leads start to become proficient. This is when you should consider challenging the exam to obtain your certification. And I want to highlight the LTC-CIP certification isn't an end goal. It is simply a goalpost in your career for infection prevention that will show you've reached a certain level of proficiency that's universally recognized in the field. Here's how we've structured the lectures. So the LTC-CIP exam can be categorized in 9 distinct areas of content. So pictured here is the first lecture, long-term care settings, which has 15 items that will appear on the exam. And each topic has multiple subtopics, which we've used to guide the structure and order of our lectures. Taking this lead, we have developed 9 separate lectures that have been prepared, and they'll cover all the topics that are going to be on the LTC-CIP examination. Now, there's simply too much content in each topic to for our series to be completely comprehensive. So I've asked our experts to include information that they think will be the most high yield so that we can fit all the lectures into 1-hour sessions. This approach is taken for a few reasons. One, for anybody who's eligible to write this exam is already working in LTC. You're busy. And to respect your role as an adult learner committed to continued education, we value your time. Secondly, just listening to these lectures isn't sufficient to pass the exam. These lectures are designed for active participation, and there is an expectation of some self-study of the topics in addition to the attention you'll pay to this lecture series. The way we anticipate consumption of this content would be in this order. So the lectures are laid out in 9 1-hour lectures that are best watched or listened to in order. So make notes with content that is unfamiliar with you and as you proceed with your studying, so you can address the knowledge gaps in subsequent study sessions. I'd also like to be clear that these lectures are specifically designed to help IPAC leads in LTC successfully challenge the LTC-CIP exam and are not to be taken as guidance or direction for implementation in your own LTC. Those choices about implementing IPAC programs should be something that is taken into consideration with Toronto Public Health, your local public health authority, your IPAC hub, and the leadership in the homes and the hospitals that you work for. So why should you commit to this education? If you are an IPAC lead working in Ontario in long-term care, your home's IPAC program is subject to the Fixing Long-Term Care Home Act 2021. In this act, there's a set of IPAC standards for long-term care homes, and part of these standards highlight the educational requirements for IPAC leads. All of this, all the way at the bottom, you'll see item K. And so it says here, within 3 years of the regulation coming into force, IPAC leads shall have current certification in infection control. And yes, the LTC-CIP certification does meet the requirement for the Fixing Long-Term Care Home Act. So I took this directly from the CBIC website. So how do you obtain this certification? First, you have to review the eligibility, and then you submit your application and fee. CBIC typically takes 7 to 10 business days to get back to approve your application for the exam or not. And at that time, you'll receive acceptance to challenge. Once you've done that, you have to schedule your exam within 90 days. So my suggestion is do not apply or register for the exam until you know you're ready to write within the next 3 months. After that, your certification, if you successfully challenge the exam, will be for 5 years. If you work in Ontario, I just want to be clear that your licensee has received money from the ministry to remunerate you if you've successfully challenged the exam as well. So here are some specifics about the actual exam and what you can expect on the exam date. So the LTC-CIP is a proctored exam, and that means that it'll be written at a designated location and it'll be observed. So in Ontario, when you register for the exam, there are multiple prometric locations that you can choose to write at, and you just choose the time that you want to write, either in the morning or the afternoon. So choose the time that you know you're most mentally alert. The prometric centers offer many different exams, so it just won't be people writing this exam on the day that you go to write. The exam starts with a tutorial. It's about 10 minutes long to orient you to how the computer-based testing system works. And then you have 2 90-minute sessions with a break in the middle. You'll have a calculator that is built into the exam so you can use for math equations. And if you right-click on answers you know are incorrect, the computer can draw a line through them so you can narrow down your answers to help you with your multiple choice strategy. And here's your ultimate goal. So we all hope, and our intention here is to help you obtain your LTC-CIP certification. So after you submit your final answers on the exam, there's a short survey, and you'll find out immediately if you're successful or not in passing the exam. If that's the case, you'll be emailed this certification, this right away, and your name here, LTC-CIP, and you can start using that designation, that certification, directly after you've challenged the exam and you've passed. So signing your name with the LTC-CIP behind it sends the message to other healthcare providers that you've achieved a level of universally recognized proficiency in your area of expertise. It also helps you to provide confidence in yourself that you in fact do know what you're talking about. It also speaks to your ability to acquire and retain new information, and perhaps you don't know an answer to something you've been challenged with, but now through your process of preparing and this designation, you have the knowledge and skills to obtain new information, and you know where the resources are. And finally, let's talk about some strategies for success. So these are things that worked for me when I challenged my CIC exam last year. So taking notes by hand is a great way to commit knowledge to memory. And then reviewing those notes within 24 hours, that's the key. This is a trick that I learned in nursing school. I found this to be very effective at helping retain information, especially within that short time frame. And be forgiving of yourself. So this exam is not for experts. The exam is written for those who are approaching proficiency, as we saw in the IPAC competency model earlier. Don't beat yourself up if something in the lecture is addressed that you've never heard of before. That's a good thing. And finding these pain points is a great way to identify your weak spots, because you're a confident, energetic professional, an adult learner, and you can teach yourself the content. So this isn't a gap. Then it isn't a gap after you've taught yourself. And so being slightly uncomfortable with the process is a good thing. It means that you're learning. Finally, find a mentor. So ideally someone who already has their AIPC CIC or LTC CIP, or someone that you trust is confident in the content matter that can help you. It's also nobody else around is really going to know what you're going through and challenging with this exam process. So it's helpful to have somebody that understands the process in itself. So with that, we're going to end the little lecture. I want to thank you, and thank you to all of the collaborators and the experts that helped put this lecture series together. I'm really excited for it, and I'm going to end here and allow you to start your LTC CIP studying process. Thank you.